Good morning and welcome to the second day of the National Home Visiting Summit. I'm Kelly Woodlock from Start Early, and we are thrilled to have you all join us today. Yesterday kicked off a lineup of thought-provoking sessions. We learned that home visitor well-being is multifaceted, and the factors that contribute or detract to well-being are not always within the control of the home visitor or supervisor. We learned that upstream policies and financial levers must work in tandem with provider voice to create equitable systems that result in fair compensation, benefits, and supports to this vital component of the early childhood workforce. We learned that setting a place for home visitors at the table in designing systems is critical. Recognizing home visitors and supervisors as experts in their work puts the power in their hands. And we explored how a father's role in encouraging and supporting mothers during the prenatal period could impact racial disparities in birth outcomes. It was a wonderful start to the 2023 summit. Today's agenda is full of workshop sessions that will dive into a variety of topics, including discussions on advancing health equity in response to COVID-19, centering equity and family partnerships in data planning, collection, and analysis, enhancing care coordination, and so much more. We're really looking forward to today's lineup. Next slide, please. Thank you. I'm sorry, one slide back, please. Thank you. From 1:45 to 2:30 today, please join us for the summit's first virtual expo. We will have representation from vendors such as Books by the Bushel, Hippie USA, Infant Massage USA, Joint Learning Ideas, and Let's Get Set. You can find our vendors in the exhibitor tab on the webpage, and we look forward to engaging with all of our expo vendors today. And now I would like to introduce today's plenary session. Next slide, thank you. New tools for listening and supporting households with young children and other adults in their lives. This presentation focuses on the need for new tools to facilitate early childhood practice, policy, and advocacy in a world of rapid change and uncertainty. Information will be shared about the Rapid Survey platform, which since early 2000 has been elevating voices of parents with young children and the early childhood workforce about their experiences, strengths, and needs. And we will explore the FIND program, an evidence-based approach that employs video modeling, coaching, and support to practitioners, including home visitors, early childhood educators, and parents. Our speaker today is Dr. Philip Fisher, director of the Stanford Center on Early Childhood and a professor in the Graduate School of Education at Stanford University. He's also a fellow at the Center on Developing Child and a member of the National Scientific Council on the Developing Child, both based at Harvard University. His research focuses on developing and evaluating scalable early child interventions in communities and on translating scientific knowledge regarding healthy development under conditions of adversity for use in social policy and programs. He is particularly interested in the effects of early stressful experiences on children's neurobiological and psychological development and in prevention and treatment programs for improving children's functioning in areas such as relationships with caregivers and peers, social emotional development, and academic achievement. He is currently the lead investigator in the ongoing Rapid EC project, a national survey on the well-being of households with children during the COVID-19 pandemic. So please welcome Dr. Philip Fisher.
Well, thank you and good morning, everybody. Really nice to be here. I'm just going to get my slideshow up and running, and then I'll be happy to get started. Okay, I believe we're good to go. Thank you all for joining. Very nice to see everybody. As a recent transplant from Oregon to California, it was very exciting to see the number of people in the Oregon contingent joining this webinar today. But also welcome to everybody else. Really a pleasure to be here and to share some time and some of our ideas and recent kind of findings with you all. I'm hoping that this will be an opportunity to learn some about some of the work that we're doing that has I think a direct number of direct applications for the important work that all of you who are in the home visiting space are doing, and just some potential tools that might be useful in the long run. Let me start by just sort of framing my comments in terms of what has been happening from our perspective in the early childhood space, the ecosystem of early childhood in this country and internationally, really, over the last 10 years or so. First of all, there's no question, many people have commented on this, that we're sort of on the cusp of a second scientific revolution where tools of science are becoming much more readily available to help us understand how to promote well-being in young kids. And I'm sure all of you have heard lots of presentations in the past about why the early years are so critical for all that follows in terms of healthy brain development, in terms of other aspects of biological development, many tools that allow us to understand how brain development occurs, and how to positively impact kids' trajectories have really been brought to the table and are increasingly being used. But I want to note that in addition to a revolution in science, that we're really seeing the evolution of science in the early childhood space, in the sense that this is not just work that's sort of happening in university settings and then being brought out into the community. There is an increasing amount of what is often referred to as citizen science happening, where communities themselves are saying, we want and need the tools that we are hearing about in the context of the kind of discoveries that are happening. We want them to be able to be useful to us. And we're happy to have researchers at the table, but we want them as partners, not as people telling us what to do. And in that context, we really see new opportunities arising in this critical window between kind of the prenatal period and when kids are entering the formal education system, whether that's if you live in a place with universal pre-K or kindergarten, there's a handoff there. But in between, it really is the context and the environment of early relationships that have the biggest determining factor on how things will ultimately go for children. And that's not just in terms of their brain or biology, but in terms of their social emotional development, their academic achievement, their relationships with peers, and so forth. So we're really zeroing in on this area of the adults in the lives of young children and ways to support those individuals as a key area that our center will be focusing on in partnerships with communities. All of you who are on this call are really sort of critical in this component. Not only are you helping to support the adults in the lives of young children, but of course, many of you are also playing that role yourself in the relationships that you have with families and in your own lives. So hopefully this information will be relevant and useful to all of you. Why is this such an important time in which we should be thinking about the context of sort of the evolution of science in addition to this revolution in science? Clearly, coming out of the pandemic, but still in our day-to-day lives, we see this right here in our own backyard here in California with all of these atmospheric rivers that have come through. We're facing a time of kind of a much higher level of unpredictability in the lives of young kids. And you can see this playing out in terms of all different kinds of domains that young children and the adults in their lives are exposed to, whether it's school shootings and community violence, whether it's climate change or geopolitical kinds of circumstances. All of these things are introducing a high degree of uncertainty in the lives of young children that really require our attention and our focus. Together with my colleague Sihang Liu, we have put some thinking into kind of how all of these pieces fit together. And you can see just in this context that we're really seeing unpredictability in terms of its impacts on families as well as on communities and kind of the larger culture. as being really a key set of influences in all of these different domains that will ultimately affect kids' well-being. And in particular, and again, this is sort of part of that brain science stuff, that we can see these things as happening by the ways that they're impacting the underlying brain and biological development of young children. Researchers who've been studying how families are doing in the context of the pandemic are starting to detect some of these effects of uncertainty. And you can see this in studies that have happened around the world, but that kind of the disruptions in school and other kinds of sort of expected things that happen in kids' lives are really having impacts on things like children's and adults' well-being and mental health during the pandemic. I want to note that I really don't want to sound alarmist in terms of the kinds of issues that I'm pointing out. There is likely, as we follow families from at least the pandemic time moving forward, to be kind of a bell-shaped curve or normal distribution about what we see as the kind of long-term impacts from the period of time that we've been living through. So there will be some people, some children who grow up where there will be long-term kind of negative impacts. We're also very clear that for many families and children that kind of struggled with various things during the pandemic, that those impacts may be just transitory and not permanent. And then at the other end of the continuum, there are undoubtedly many contexts, and I'm sure many of you are in some of these contexts where families were really able to, and communities sort of circle around young children and support them, and we're not seeing necessarily any kind of immediate or expected long-term impacts. And for some, there's been growth during this period of time. So again, not all just a sort of a dark and depressing story. Nevertheless, we're really at a time moving forward where we continue to see that there will be many challenges, and really, in the context of early childhood, what we're really thinking needs to increasingly happen are two very simple things. First, we need better ways of being able to listen to the adults in the lives of young children, to understand their experiences, to lift up their voices, and to design supports and services in the context of things like home visitation that are really listening to what people are saying they want, what they need, where the strengths already are that we can help to support, and so forth. And then once we're kind of more able to really listen and understand what people are saying is most important, then we need to develop ways to support children and the adults in their lives in the context of their community in ways that they're asking for. So to design more around kind of the end user instead of coming in with preconceived notions about what's needed. I can think about this in the context of some of the discussions that happened in the early childhood home visiting space that I was part of at the early stage of the pandemic, where there was a lot of uncertainty. Some people saying, well, we've done these programs and they require that we do home visits in order for us to understand that they'll be effective because that's what all the data shows. But others saying, look, families are telling us that, and they've told us for years that home visits are not necessarily always desired or always preferred, maybe sometimes being supported on the phone or other ways might be useful as well. And so I think that's just an example of how even in the home visiting space, that we really need to design around what families are telling us is most useful, not just sort of what the research base might have originally shown. So first, I'm going to talk about a tool that we've developed, and you heard this in the introduction, a tool that we've developed specifically for listening to adults in the lives of young children more effectively. And then I'm also going to share about a tool that we've developed for supporting adults in the lives of young children in various contexts in the US and elsewhere. So first, let me start with our tool for listening. It's called the RAPID survey. RAPID originally stood for Rapid Assessment of the Pandemic's Impact on Development in Early Childhood, because we're sort of really focusing exclusively on the pandemic. we now just use RAPID as sort of a non-acronym term because it's a quick survey that we're able to turn around very, very fast. So RAPID is a 15-minute online survey. People are able to take it on a smartphone or tablet or computer. It's available in many languages, and it goes out quite frequently. Right now, the national survey goes out on a monthly basis. Every time it goes out, we ask about 5 key domains, so parent and child well-being, the economic or material circumstances of families, how much they're able to meet basic needs, their childcare circumstances, and healthcare. And the way that we ask questions allows us to produce both numeric data, the proportion of households, for example, in which families say they're having difficulty making ends meet, but we also ask open-ended questions, and this provides a really big wealth of information about what's going on in households. So not just the what, but the why. We have found over time that by collecting data very frequently, that we're really able to turn information around and get it back out. In one way, the most important way that this data goes back out is to let families and other adults in kids' lives know that we hear them and that we understand what they're going through, and other families are also able to sort of see what others are going through. This also, however, has a big impact on policy and advocacy and on the way that efforts to support families are designed. Originally, RAPID launched in April of 2020, right at the outset of kind of the period where things were shutting down. And the goal of each time the survey goes out is to hear from about 1,000 households across the country. The sample is quite diverse in terms of income, geography, and race and ethnicity. And we continue, as the data comes in, to be pushing out information about what we're learning on the RAPID survey website, which you can see here, and also on medium.com. So lots of reports about what's been being found. The survey is kind of overseen by an advisory council, and you can see many of the very amazing people here that come from not only the research world, but policy and advocacy, funding. We have parent representatives and childcare provider representatives on the national advisory as well. Let me just tell you a little bit about what we've been learning as we've been listening to households over the past period of time. So first and foremost, I think probably the most dramatic information that we've been getting is the tremendous prevalence of difficulty paying for basic needs. So this concept of financial and material hardship is basically the proportion of families that say they're unable to pay for things like food, housing, utilities, childcare, healthcare. And what you can see is in this national sample that starting at the beginning of the pandemic, we saw about 1 in 3 families couldn't pay for basic needs. There's this period in the middle here where the rates dropped. And again, it didn't drop to 0, it dropped to 1 in 4 families, but still a very substantial drop. This is a period of time when the kind of majority of government policies, including the child tax credit that had a potential to impact families' economic circumstances, were in place. And then you can see what's happened as those supports were removed and consumer prices have gone up, which is that the numbers, the proportion of households not able to pay for basic needs has actually increased to pre-pandemic levels. So this is something that we're tracking and very concerned about. Why are we concerned about this? Well, there's plenty of research that we've done and others have done in the past. Some of this is some of that brain science research that shows that there's a pretty strong connection between families struggling to make ends meet and then the ultimate impacts on children. And so we've documented this in our survey that if in a given time point where we collect data, a parent will say, I'm having difficulty with basic needs, that subsequently when we follow up with that family, we see increases in distress on the part of the caregiver. And then when we follow that family further out in time, we see that they're reporting that children are distressed. We call this a chain reaction of hardship, the way that not being able to cover basic needs in your household can really impact your child's well-being. And there is an additional large amount of data suggesting not just from our survey, but that this is really a concern if we want to promote the well-being of all children. You can see this is sort of further underlined or underscored in our data when we look at the proportion of families that are experiencing hardships. And then if you look at the number of areas in which they can't make ends meet, so you add, I can't pay for food, I can't pay for housing or utilities, as those add up, you can see that the levels of material distress for both parents shown in yellow and for children, the parents' reports of children shown in gray are increasing kind of progressively. More hardships equals more distress for both parents and for children, not surprising. But we've also found, and this gets back to one of my original comments, that it's not just whether people can pay for basic needs on a kind of ongoing basis, but it's the predictability of your financial circumstances that makes a really additional big difference. So when we look at how much people's finances have changed over time and how much from one time point that we gather information to the next, things are unpredictable. We see that that adds an additional amount of distress to both parents and to what parents are saying their kids are going through. So unpredictability, really another big challenge. On the flip side of this, we have colleagues at the University of California, Irvine, who found that one of the things that actually made the biggest difference in reducing children's distress during the pandemic was predictability in the day-to-day life. So it's sort of this flip side. Unpredictability makes things more difficult for parents and children, to the extent that parents and other adults in kids' lives can create more stable routines. That actually has the potential to offset or buffer kids from stress. I just want to provide a little bit more information about kind of what a useful tool this can be for understanding what families are going through, in the sense that, as I mentioned, we don't just collect quantitative information, but we also ask a lot of open-ended questions. And households have been incredibly willing to share with us what they're going through in responses to these kinds of open-ended questions. So, for example, we've asked parents and other adults, what are your biggest concerns that you're facing at this point in time? And you can see that we've had over 200,000 responses to questions like this. When we analyze that data, everybody's heard about ChatGPT and all of these new tools for analyzing lots of complex data. We can actually gather information from all of these kind of written responses about what are the major themes running through households in terms of their concerns. You can see the kind of top 20 list from the what are your biggest concerns. I hope the slide is big enough for you to see, but you can see school, job, money, work, and childcare, those kinds of things were listed by families as some of the biggest concerns. So very useful for sort of understanding what are the hottest topics overall in the course of the survey. But this tool also allows us to see how various comments and concerns or bright spots might change across time. So this is just a little bit of a data slide that shows, if you look at the frequency with which parents have said concerns about school are of their biggest concern, you can see that that actually changed over the course of the summer and into the fall of the first year of the pandemic, where right around midsummer, those concerns were coming up a great deal. And then as we went into the school year, they dropped off. So just a really good way for having an ear to the ground about what's going on in families. In addition to being able to use that kind of information to find out how things are changing across time in terms of concerns, we can also look at data in terms of different categories. So this slide, I think, is really helpful because what it shows is the differences between families that are above the federal poverty line on the top and what they're, sorry, on the bottom, and what their biggest concerns were during the pandemic versus lower income households and what they said their biggest concerns were. So if you look at on the bottom, the more upper income, middle and upper income families were largely talking about missing family, having kind of stress in their households, being worried about cases increasing, whereas you can see that like basic necessities and working and debt were really raised much more frequently among lower income households. So we can really see kind of how themes differ depending on the demographics and the circumstances of families and design around that. We see increasingly that the information that we're gathering is being used to inform the way programs are being designed to support families. For example, really emphasizing the positive impacts of quality time and daily routines that we're seeing in our data among people who are working directly with families. We also see that a lot of advocacy and policy decisions are being affected. So for example, the vast rates of material hardship is something where the data has been used to show that it's important to get financial supports to families with young kids. This is also really just helping us to understand kind of what's going on from a more scientific perspective in the lives of households with young kids. We think that there is lots of potential to continue to use this as we move forward. One of the best ways that we're seeing to sort of expand what this kind of survey can do is that we've had many requests from both states and from communities to do these surveys specifically in local settings. And we have local surveys happening in a variety of places around the US, including several communities in Michigan, a couple in Texas, and other places around the US, where we're seeing people wanting to take this data and really understand what's happening at a community level to make sure that that supports are available. Just to give you an example of how this might be useful, as people know, there's a big disconnect between the supply and the demand in terms of childcare or care for children. And in a lot of communities, that mismatch isn't just kind of that there isn't enough supply to meet the demand, but that parents' preferences for the type of care, whether it's home-based, center-based, family, friend, and neighbor, or relative care, that we're really not sufficiently necessarily designing and providing the kinds of care that families would most like. And so this is a way that kind of that local data can be really helpful. There are a number of other ways that we see RAPID continuing to expand to really be able to more effectively listen to the voices of households with young kids. So that's sort of like the listening. And one of the things that we've been thinking about a lot lately is maybe it would be helpful to also sort of do a survey of people who are engaged in home visitation to hear about not only what their perceptions are, but also what the needs are of home visitors in order to be able to support the work that they're doing with young children and adults in their lives. So this is something that we're kind of thinking about and actively considering in terms of another kind of iteration of the RAPID survey, where rather than just focusing on household voices or the voices of early childhood care providers, we're also focusing on home visitors and kind of what their experiences are. So let me give you another tool. This is not for listening, but this is for supporting. This is a program that developed about 10 years ago in our team that was designed around what we were hearing in community contexts around ways to support adults in the lives of young kids, which was there's too much emphasis on reducing the deficits or the problems that exist. And a lot of the families and other care providers in kids' lives do not respond well to being told what they don't do well or things that they don't know. We really need to have a more strengths-based approach. And our team had actually been thinking about this for quite some time as well, because we had been developing support programs for adults in the lives of young kids that really were oftentimes oriented to, here, let me tell you something you don't know, or show you something that you don't know how to do. We realized that, and this was kind of learning from others who had begun to do this, that if you look closely at what parents and other adults are doing when they're interacting with young kids, that there's a multitude of good things happening that kind of fly beneath the radar. And that if we could really lift up the things that we know that science shows are at the core of healthy interactions to support children's development, and make those more observable to these adults in the lives of young kids, that we could potentially have a very big impact and be much more engaging and positive with those that we work with. So in that context, what we did was to develop a video coaching intervention. FIND stands for Filming Interaction to Nurture Developments, because at the core, what FIND is really about is showing adults what they're doing that's sort of in this core area of serve and return. This is something that occurs across all contexts, not just with parents, but also with other care providers and educators in the lives of young kids. So it's a basic kind of component or kind of kernel of interaction that really is what drives a lot of healthy development. And we realized that we could use video to show people when this is already occurring, when it's something that they're already doing, make it much more salient and observable to them. And therefore, actually, the idea was if we could show them what they're already doing, maybe they would do more of that. And indeed, our data suggests that that's exactly what happens. This is a very brief-based approach. So we go out into the natural environment, we film either parent or other adult in the child's life, and then we bring it back. We extract the key content to it, where we're showing these things. And then we have coaching where we're then showing the adults exactly what it is that they're doing. It's an approach that fits really nicely in the context of home visitation. It's not meant to replace it, but rather to supplement it as a tool for engaging the adults in kids' lives. When we talk about these kind of core interactions, what we're talking about is this serve and return process. And for the purposes of our coaching, what we do is to break that down into 5 different components, or what we call elements, that we introduce sequentially across coaching sessions. So in the first one, we focus on sharing the child's attention or joint attention and instances where that's occurring. Then we show instances in the next coaching session where the adult is supporting and encouraging the child. The third session is all about naming, using words to name the emotion, the action, or the object that's the focus of the child's attention. And then the 2 subsequent sessions are really extensions of the serve and return process. One where it continues back and forth after the initial interaction, and then the last one where children's attention shifts to something else and the adult follows the child into the next kind of focus of the child's attention. Again, in terms of like, what might that do if you just show people what they're already doing right? We have data from an independent evaluation that was done by a team at the University of Washington using this device called the Lena, which keeps track of the amount of verbal exchanges happening. And we can see that just by showing in the context of early care environments, adults what they're doing correctly, we see an increase in the amount of words that the adult is uttering in a given hour and the amount of back and forth conversation that's happening. So very powerful tool without going into a lot of correction or teaching, rather just showing people what they're already doing right increases the extent to which they're doing that. We also see positive effects. So it's not just what's happening in the child's language environment, but also what's happening with the child's own language. You can see an increase in the case of FIND in this sort of straight line that's not dotted from before to after people have gotten this coaching. And same is true in terms of these 2 different categories of child's language development. The other thing that we found that's quite exciting is that when we show these videos to parents and other adults, we actually see changes in this one area of adult brain activity related to self-control. The idea that you're stopping and waiting and watching what the child is doing, it seems to have this collateral benefit, additional benefit for adults, which is that it really helps them to slow down and wait for kind of the thing that they're looking for next. And so really, even though we talk a lot about young children's brains and sort of their flexibility, it's also noteworthy that you can actually detect changes in the brains of adults who are really slowing down and paying more attention to what's going on in the lives of young kids. Because this is something that cuts across all different kinds of contexts, not just something that's designed for parents, but also for other adults in their lives. We've implemented this and evaluated it in a number of different contexts, and we see it as having a lot of potential possibilities. We're also now in the process of developing a sort of a bigger professional development platform for Find, where in addition to doing sort of the slightly more intensive filming and extracting content to use in coaching, that we're developing a large library of video clips that show when other people are doing this, so that if people want to access that and be able to show it to parents or to others that they're working with, that there will be lots of viable examples that are connected to the age and the demography of the individuals that they're working with. So that's something that's in the works and will be ready to be released in its first version later this summer. So let me just sum up here. We'll have some time for Q&A, but where I really wanted to leave things here was to say that there is no question, and I think we're all probably in agreement about this, that there are many challenges facing households with young kids and kids themselves in the context of today's world. We see that happening on a continuous and ongoing basis. And I think most people would agree that even if we're kind of out of the darkest time of the pandemic, that we are likely to continue to face a variety of different kinds of challenges and disruptions and uncertainty, but also that there are many bright spots, not just in terms of what's happening with science, not just in terms of what's happening in terms of communities really rising up and saying, we want to support the well-being of our youngest members of the community, but in the ways that that all of these things kind of begin to fit together to promote positive outcomes. And we see lots of really exciting initiatives happening around support and increased wages for childcare providers, around other ways to think about family support. So all of these things kind of bode well. I think the question then is, like, how do we, especially we who are in a position to help support a lot of this work moving forward, how do we contribute? And I think what we're saying is that tools like the rapid survey and tools like the video coaching model that we've developed with Find are ways to help support the work that's going on in the larger ecosystem. We really want to be clear that we would think it was arrogant of us to say, we have all the solutions and we're just going to put them out there. But we do believe that by working together in the context of community partnerships and organizational partnerships, that we can go a long way to address a lot of the challenges that have really limited progress, and then in the context of the pandemic just created new sets of challenges. So if you're interested in learning more about the RAPID project, if you're in a community setting where you think this would be really interesting, if we could do RAPID in our community, or you want to know more about whether RAPID at the state level might be coming to your state, we actually have a large statewide survey of RAPID just getting underway in California, and we expect to add other states. Please go ahead and get in touch with Christy Carmen, who oversees that project. And if you want to know more about Find, about the video coaching, or about the new professional development platform that we're going to be launching in the summer, then please get in touch with my colleague Kendall Yada, who is overseeing that aspect of the work. We would really love to hear from you, not just about kind of interest in, is this something that we could do, but if you have input or feedback or ideas that you think would be helpful for our team to hear about, again, from that perspective of that the science is something that we're all engaged in together, we would really love to hear from you. So I'm going to stop now. I see that there are some questions that have begun to come in the Q&A area. So I'm just going to stop sharing my screen so that you'll be able to just see me, and then we'll have an opportunity to chat about questions or comments or thoughts that you might have based on this presentation.
Thank you, Dr. Fisher. The chat has been very active and with appreciation for your engagement directly with families in the workforce. And we have several questions in the Q&A chat box as well. So I think we'll just launch into a few of those. One question was, yesterday we had heard about the importance of disaggregating data particularly by race and ethnicity. So we have a question about whether you have analysis by race and ethnicity, and if so, what have you learned?
We do. Thank you for that question. It was very important for us from the get-go to be able to do disaggregations because it was very clear, even though there was a lot of that talk about we're all in this together at the beginning of the pandemic, that really pandemic experiences were quite different based on different demographics. So as I presented some data, we've looked a lot at how income levels have made a difference. But I also want to be very clear that we have found consistently differences when we segment the data by race and ethnicity. A couple of things. First of all, not surprisingly, things like rates of hardship and difficulty paying for basic needs have been much higher among Black and Latinx households in our survey. And what was especially concerning, which is kind of an indication of a racial wealth gap that's been well documented before, is that many of the Black and Latinx families that when we were asking in the first year of the pandemic, are you experiencing difficulty paying for basic needs? Many of the Black and Latinx families that said, yes, we are experiencing difficulty, were actually of middle and upper income before the pandemic started, suggesting just a much greater vulnerability in the context of these kinds of disruptions due to things that have been documented previously, like less accumulated wealth, more difficulty obtaining credit when needed, higher interest rates being charged, less kind of stable and secure jobs, and also a tendency when there is wealth and affluence to be supporting external family members outside of the home and extended family members in the home with this income. So very clearly, that's the case. However, there are other things that we've noted that are quite interesting. So for example, among Black households, we actually saw that the increases in stress that were sort of found across the board at the outset of the pandemic were slightly less for Black households. And when we delve into the qualitative data, it appeared that the finding was the result of the fact that the kind of background level of stress that have historically existed, this was adding some, but it was not as much of a totally unexpected event as it was for other households. So yes, very clearly differences based on race and ethnicity. Other interesting differences based on rural versus urban, based on whether households have a special needs child or not. So very much able to kind of look at the data in those ways.
Great, thank you. We had some questions about the data samples. One question really was related to this is not longitudinal data, correct? And if not, does your sample change every time you issue a survey?
Great question. We talk about the survey as kind of being like pragmatic research in the sense that we knew from the get-go when we started the survey, we're actually doing on a weekly basis and getting 1,000 households per week. And we've shifted to a monthly survey. But nevertheless, we knew that we could not expect families to just sign on to take a survey in a repeated way and hope to keep everybody engaged. So it's actually a mixture where we have some families that have taken the survey repeatedly, very consistently from the get-go, others who have taken it once or twice. And the way that it works is that we initially recruit people and ask them about their willingness to participate in the survey, and then tell them that we'll be inviting them to take the survey one or more times. And that's one way that we've been able to maintain a little bit better representativeness in terms of the demographics, is we don't just sort of randomly put it out there and hope that we get enough of everybody, but rather we're inviting people to take the survey each time it goes out. So it's kind of a combination of cross-sectional and longitudinal data. And from that, we're able to sort of stitch together analyses that allow us to make some of these longitudinal conclusions, like that chain reaction of hardship that I showed, where not paying for basic needs is stressing out parents, and then that's getting passed along to children.
Great, thank you. We had a second question related to your data, and that is, where can people find it? So would they find it on your RapidEC website?
Yes, the RapidEC website has all of the data trends that we're seeing. So that one graph that I showed that shows material hardship rates across time. You can see other trends that are about parent and child distress levels, childcare and healthcare as additional trends, and then also a multitude of fact sheets and blogs that we've posted over time that describe the specific results. If people have additional kind of questions about the data, are interested in kind of learning more about what else could be obtained other than just what's been posted, we are happy to share that. And again, you should get a hold of Christy Carmen on our team to learn more about that.
Great, thank you. We have a question about policy and research. What key ideas and findings do you think will be most important for policymakers and researchers to keep in mind as we near the end of the public health emergency and Medicaid chip unwinding?
I mean, I think there are a couple of things. First of all, as we've highlighted, the extent to which parent well-being and then subsequently child well-being is tied up in the financial circumstances of households has really kind of consistently come through in the data that we've been looking at. So there is like no question about that. And because we see, although this wasn't done in a kind of experimental way, where some people got government benefits and others didn't, but what we see is that the fact that when the majority of the greatest number of government support programs were in place, was when we had the greatest impact on the rates of hardship in our households that we're following. I think there's pretty good examples of how these kinds of supports can really help mitigate some of the stresses. So I think that's one thing for sure that's really, really important from a kind of policy perspective. The other is that we have done a parallel survey, did not present a lot of data on this, of the early childhood workforce. And that data has told us numerous things that are quite important, and again, are reflected in what others have found as well. But the extent to which we see even higher rates of difficulties paying for basic needs in the early childhood care and education workforce, I think is pretty unconscionable and something that we need to be paying attention to. In particular, family, friend, and neighbor care providers and center-based teachers have consistently been the two groups that have the greatest amount of distress, the greatest amount of hardship and difficulty paying for basic needs. And it's an area where we really see there as being a lot of need to shore up issues like compensation, financial stability, and other things for the workforce. If we really want the country to be whole, we want the economy to be whole, we want parents to be able to do what they want to do, then the early childhood care and provider workforce is a really critical area for policymakers to be addressing.
Great, thank you. We have one more data question, and we have several questions about the FIND program. So the data question is being asked, out of all of the data you've collected, what results have been most surprising to you?
I think the data that's been in many ways most surprising has to do with the incredible resilience that we see in the context of the challenges that people have faced. In particular, I think the extent to which people have said that things like quality time with their kids is actually not just helping their kids, but it's helping them. Seems to be something that oftentimes we forget, that we think about the importance of adults in the lives of young children. I think it's equally important to recognize that the importance of young children in the lives of adults is something that we see as a major positive factor, and something that helps to promote resilience for all. And so I think that was one of the really important big findings. I think another thing that's really stood out to us that wasn't unexpected, but that's just been so consistent that it's been very hard to ignore, is the extent to which families that identify having a child with special needs really have had a lot of the same challenges that some of the most economically marginalized or marginalized by other kind of structural issues have faced in terms of their parent loneliness, in terms of economic distress, in terms of a variety of other issues that ultimately impact parent and child well-being, that special needs households are ones that I think have not gotten sufficient attention and kind of supports in place during the pandemic. And in many instances, I think those are ones where, when I showed that kind of bell-shaped curve about where things maybe aren't just going to get better on their own, where we're going to see some lasting impact. So I think those are some of the highlights. And I would want to note that they're not just highlights that say things are worse than we expected, but rather things are better. Lastly, I'll say just the tremendously high rates of hardship that we're seeing in households has been hard to witness. And then when we see even higher rates among the early childhood workforce, it's sort of unconscionable, I think, to those of us in the survey to think that we expect people to provide nurturing care to our children so that we can go out and work and do other things, when in many instances these individuals are saying that by the end of the month they don't have enough money to pay for food, that they're skipping meals, feeding other family members instead of themselves. That just is really, it's shocking. And we really can't sort of underscore enough how much that seems to be an unreasonable expectation in our culture.
Great, thank you. Just as I mentioned, we have a few questions about the FIND
Sure.
project. One question came up was, as you were, conceptualizing FIND and creating FIND, did you have an opportunity to look at some of the other video intervention options that are out being utilized by home visiting programs? And if so, what did you learn, and how do you see this aligning with some of the other approaches out there?
There are many video coaching approaches, and FIND is by no means the only one. I think when we developed FIND, we were influenced a lot by some of the video coaching models that have developed in Europe, in particular one called Martimeo, that is very much focused exclusively on strengths-based approaches. So I think that's sort of one aspect of FIND that we were really emphatic about, that we knew that there were other approaches that that included kind of here are some instances of doing great stuff, here are some instances where things didn't go so well. And part of our effort there was, again, informed by families and others, including close partnerships with child welfare, where the feedback was, if you show these kind of negative instances along with positives, you just sort of cloud people's ability to focus in on the good, because it arouses so much negative emotion and it just becomes not such a great experience. So that's one way I think that we distinguish. Another is that the coaching in FIND is purely descriptive. So a lot of other coaching models may get into greater details about what you might think the child is thinking, or what you're feeling during the time when this is going on. Again, we do not sort of take issue with any of these other approaches. We think they all have potential benefits, but we did feel like in order to maximize the scalability of FIND, that we just simply wanted to have the coaching involve saying what you see and being very descriptive and straightforward about what's going on. So it's not to say that like ours is better, but just that we were very kind of influenced by what we were hearing from parents and from practitioners about the things that would be most effective. And again, we see FIND as complementary to other approaches rather than sort of set out to replace them.
Great, thank you for that answer. One other question, a follow-up, is how have families responded to being recorded or to being engaged in this process? Any learnings there?
So this is a question that almost always comes up, concerns about, how do people feel about being filmed? I think there is no question that sort of at the outset that families may sort of wonder about, how's this going to feel? People adapt very quickly and adjust to having, especially since it's a tablet or a smartphone that can just be set up on a tripod for the filming, or that the home visitor can do it, as part of their kind of other activities that they're engaged in. But I would say the other thing that's really important is in explaining the coaching, and then as soon as it begins, it's sort of very analogous to kind of social media these days, where people love seeing positive instances of things going on. And so as soon as we start to show clips in which child is doing something super cute, or kind of exploring the world and the adult is responding, people really kind of resonate and are drawn to that. In fact, in many of the coaching sessions that we've conducted in homes, what we see is the child actually then, this might be an 18-month-old or a 24-month-old will crawl up in the parent's lap as the coaching's happening, and it's a nice moment of parent and child together. So I think it's sort of, a lot of it lies in how it's explained, and then once people start to see it, they really benefit from it. The other thing I'd say is we've done it in group contexts, and it's also a tremendously positive experience for peer support. I can think of a number of times when we've done it with teen parent groups for school-based teen parenting programs, where it sort of changes the whole tone of the group from being a little bit more negative and snarky, to people being really supportive of each other's efforts to interact with their kids, and just really positive about each other's kids. So lots of positives there in our experience. Doesn't mean that people aren't a little bit nervous from the beginning, but it really smooths out quite quickly.
Great, thank you. I think we have time for one more quick question.
Sure.
This is a big picture question for you, Dr. Fisher, but the question is, it is clear that even after the pandemic, we will likely see many destabilizing forces.
For sure.
Can you distill 2 or 3 absolutely crucial or universal concepts that must be maintained by families in order to ensure the best results for security, attachment, and mental health, regardless of what comes next?
Yeah, that's a really great question. And again, I probably would have answered this the same way before we had all of the survey data from Rapid, but it's just been underscored. So first of all, there is nothing more important in promoting healthy development in the early years than this serve and return process. The extent to which, when children are going about their business, kind of doing what they do, exploring the world, beginning to use utterances, all of the things that are sort of part of the child's social, emotional, and cognitive development, that to the extent that adults are sharing what the child is focused on, and connecting and responding to it, that is the basic building block of healthy development. And so ways that we can continue to support the kind of serve and return interactions are really critical. And when you layer on some of the issues that we've been talking about, things like unpredictability and instability, it's really kind of at the micro level, the extent to which the day-to-day environment is predictable in terms of adults paying attention to what's going on with kids, that we see the greatest potential for impacts. I would just say at a kind of more meta level, again, like maintaining daily routines in the face of uncertainty. So having regular meal times, having regular bedtimes as much as is possible, really important. And then the last, which I see as very optimistic, is one of the variables that we measured that we didn't ask people, we didn't define it ourselves, but we simply asked people about the importance of quality time. And when people say they're spending quality time with their children, that seems to have a direct offsetting effect on the effects of unpredictability and uncertainty in people's lives. So just simply taking pleasure in and having a good quality experience with your child can go a long way. And I think sometimes we think too much about like what needs to happen in that interaction, as opposed to just that it feels really good to people. But it's just sort of like an important piece that anybody can really relate to, is just making sure that there's space and time in people's lives to connect with young children.
Thank you so much, Dr. Fisher, for joining us today. The chat was so alive. I know there are a lot of comments in there that we'll want to go back through and look at, but we really appreciate your time, and for you and your team to share this level of data and information and insight has been incredibly valuable. So thank you for joining us today.
Thanks. It was my pleasure, Kelly. Thanks for all of the great questions and for the comments in the chat. Really appreciate it.
Right. Thank you.